The lung meridian, as part of traditional Chinese medicine, is known as the prime minister. So it plays an incredibly important role within the body. And when it is a yin organ, which means that it is working all of the time, so we need to breathe all the time, and its partner is the large intestine, which only works when food is in the intestines. So yang meridians work only when asked, and yin meridians work all the time. And the lungs, they control our energy because of the oxygen that is going to every cell in the body, and it also is getting that oxygen to the blood. The lungs also control the skin and perspiration, and those who have a balanced lung meridian often have a radiant energy because they're breathing correctly, they're getting enough oxygen around the body, so they tend to, and of course they have this glowing skin. So if you've got a client who, say, has some skin issues or it doesn't have that glow, then you could be thinking there could be something going on with the lung meridian. So what do the lungs do? It's essentially very simple. It is the air that we breathe, and it is, as the lungs expand, they take in oxygen that is needed for every cell, and as we breathe out, we expel the waste of carbon dioxide. And the lungs sit as this partnership with the large intestine in the metal element, and it's very much about excreting our waste. So the large intestine's responsibility is to excrete our food waste, and the lungs' responsibility is to excrete our breathing waste. So the better we are at letting go of our waste, the healthier this meridian is. So the muscles in the lung meridian, they tend to be around the lungs. So we're looking at the chest and the shoulders. We've got the deltoids in the shoulders, and we've got posterior deltoid here as well. Craccobrachialis, which connects the arm to the chest. We've got the diaphragm, which sits around our core. And as we take a deep breath in, our diaphragm expands. So there is definitely this connection between the lungs being able to do their job and the diaphragm supporting them. And then there's the anterior serratus, and this is a big muscle that surrounds the ribs. So what we see with common imbalances in the lung meridian from a kinesiology perspective, we can see things like asthma, breathing difficulties, pneumonia, poor immune function, mucus buildup, COPD, a feeling of a tight chest. There is this connection also with anxiety or shallow breathing due to stress. This can really, when we explore the lungs from a meridian perspective, from a functional kinesiology perspective, stress plays a real role in creating lungs becoming a victim of what is going on with stress. The more stressed we are, the more that the lungs are compromised. So from kinesiology, how do we balance the lung meridian? Well, we use the Bs, biochemical, emotional, electrical, and structural, which is wonderful to have this toolkit of different approaches to be able to balance the lung meridian. Our focus from a biochemical perspective is that we are looking at reducing inflammation. So we work with anti-inflammatory diets. And if there is mucus present, then we look at food intolerances, particularly things like wheat and dairy, that can create more mucus in the body. We also look at a nutrient-dense diet plan of eating rich in antioxidants, vitamins, and we also use herbs to balance inflammation or mucus if it's present. So from a foundation kinesiology perspective, we will be looking at food and diet and food intolerance in testing. As you move into practitioner, we will be looking at supplements, and supplements for the lungs include vitamin C, D, and E, which is going to be coming from our fats and also from our carbohydrates, such as fruit and vegetables. Adaptogens we use adaptogens across the board in all of our meridians. We absolutely adore them. They're our medicine approach as a natural practitioner. And the adaptogens that we would look at for the lungs include olive leaf and reishi mushroom, which are very supportive from an immune function perspective. And when we're looking at minerals, zinc is our go-to when it comes to the lungs and the immune system, a really, really important mineral that plays lots of different roles in the body. Emotional balancing, as I said earlier, the lungs sits in the metal element in the 5-element traditional Chinese medicine model. And the emotions involved in the metal element are grief, letting go, guilt and regret. So very much this holding on is a very common thing that can make the metal element imbalanced. So if someone goes through, say they go through a loss and they go through a grief, that instant shock, taking that deep breath in affects the lungs. And then if we struggle to process grief or letting go, and we want to hold on, then we find that we restrict the breath, and this from an emotional perspective can affect the lungs. When we look at grieving is an important process that we go through in life. And if we find a way of being able to process grief and come to a point of acceptance, understanding, and meaning, then we can find that the lung meridian can be very much balanced in that way. And so our emotional work as functional kinesiologists, we are looking at building resilience from the inside looking out, and also creating a process of understanding purpose and meaning, which can really help balance from an emotional perspective for the lung meridian. The electrical balancing, the lungs optimum time is in the morning. It's 3 to 5 a.m. in the morning, and those with an imbalance in the lung meridian will often wake at this time and not be able to get back to sleep. Now, the traditional Chinese perspective is that we could be getting up at this time and doing some deep breathing, some deep meditation. It is a time of rest in the world, so it's an ideal time for meditation. Not that many of us like to get up at that time in the morning, but if we can do that deep breathing around, it's a lot of yoga practices get us up between 3 and 5 in the morning to do this deep breathing meditation practice. And then as we move from the lung meridian time into the large intestine time, it's common that we see this deep breathing meditation aspect really supports the large intestine. So we have a nice morning bowel movement. How marvelous. So structurally, the lung meridian, because it's connected to all of these muscles in the upper part of the body and the shoulders, then we can often see tight shoulders or a collapsed chest being a common structural giveaway if there is a lung imbalance. So we're sort of seeing these hunched shoulders. And to balance the lungs structurally, we look at stretching the chest, opening up the chest, and breathing deeply and slowly, and teaching clients how to breathe deep into that lower lungs, especially if people are breathing very shallow. If we encourage them to take that deep breath, then that can really structurally support the lungs. So the lungs, how do they fit into the triangle of hormonal health, which is core to the work of a functional kinesiologist? Well, the lungs are seen very much as a victim of the triangle, and that is if we have imbalance. So we've got the triangle is the spleen meridian, the triple warmer meridian, and the circulation sex meridian. So it's our blood sugars, our stress, and our sex hormones. So when our blood sugars are imbalanced and we have got high stress and we've got imbalanced sex hormones, then we tend to see an increase in inflammation, shallow breathing, a decreased immune function that all has this knock-on effect to the lungs' health. So it is really important to be balancing this triangle if we want to have good lung function. So that is the lung meridian.